Well, I do want to be respectful of everyone's time, so we can go ahead and get started. And then as people, no worries, Jolene. I see you there, and Jolene is using the chat, so if you have any questions, feel free to drop them in the chat. Several folks did submit questions ahead of time, and so we do have those, but you are welcome to drop questions in the chat throughout tonight, and I'll keep track of that. And then when we do our Q&A, I will pass those on to Dr. Sewell. Thank you all so much for joining us for our second Women in Epilepsy webinar series about stress management. We are thrilled to have you join us this evening.
I can't understand a word she's saying.
You're on speaker.
Can't see.
Can everyone else hear me okay? Okay. So we are thrilled to have Dr. Kelsey Sewell join us this evening. She is an assistant professor in the departments of psychiatry and behavioral sciences and neurology with the University of Kansas Medical Center. She's been a faculty member since 2017, and she supervises and trains psychiatry resident physicians, medical students, and psychology trainees. She also provides assessment, psychotherapy, coordination of care, and other support for patients receiving care at the University of Kansas Health System's Comprehensive Epilepsy Center and the Parkinson's Disease and Movement Disorders Center. She also conducts psychological evaluations for patients considered for deep brain stimulation, also known as DBS, neurosurgery for epilepsy, and focus ultrasound. She earned her doctorate in clinical psychology with a health psychology and behavioral medicine specialization from the University of Utah. After a one-year predoctoral internship in behavioral medicine at the VA Palo Alto Healthcare System, she finished a year-long postdoctoral fellowship at the University of Kansas Medical Center in clinical health and oncopsychology. She also has a master's degree in clinical psychology from the University of Utah and a bachelor's degree in psychology and women's studies from the University of Kansas. Her professional interests include improving behavioral health, medical adherence and quality of life, individual and dyadic approaches to coping with serious illness, behavioral and psychological strategies for improving management of medical conditions, psychiatric conditions, sleep, and sexual health across the lifespan. In addition to being a popular invited lecturer and speaker, Dr. Sewell holds membership in the Kansas Psychological Association, where she serves as a membership chair, and she's a founding member of the University of Kansas Medical Center Early Psychology Faculty Support Group. We are thrilled and honored to have Dr. Sewell here tonight. I think it speaks volumes to the relevancy of this topic. We had 26 individuals sign up for this seminar tonight, so I think it's very timely, certainly all the time, but never more as during a global pandemic and post-holidays. So Dr. Sewell, we're thrilled to have you here tonight, and thank you again for your time.
First, well, hello, everybody. Our department wrote those for us, by the way. I just sent that along. It's very long. Anyway, so it's really nice to talk to you, see you all. Thank you for inviting me. Please excuse my voice. I'm sick. My 1-year-old has his 12th illness in the last year, and I've caught at least half of them. So you know how that goes, some of you. So anyway, my voice I'm fine. Don't have COVID, luckily we know that, but it is a little squeaky. Let me just share my slides really quick.
Yeah, and I just made you host, Kelsey, so if you have
Excellent.
issues, let me know, but it should be good to go. And just a reminder, as she's pulling up her slides, if you have any questions at all throughout the presentation, just drop them in the chat and we will get to those at the end of the presentation.
So I've done a couple, so I think this is the best for you all to see, but they should advance. So if they don't interrupt me, because that's one problem I've had the last few times is that my slides haven't advanced right. And it's usually my fault from having 2 computer screens. So if it doesn't happen, let me know. Okay, so let me just try one of them. Did that advance for everybody? Okay, excellent. Then great. So when I talk about evidence-based techniques for stress management with trainees, like people I'm training to do stress management, I always talk a lot about what causes stress. And when I talk particularly about epilepsy, when I'm training, especially psychology interns in working with people with epilepsy, I talk a lot about why epilepsy causes stress. But when I was thinking today about keeping this to 30 minutes, I decided that I don't need to tell you that all of the reasons that epilepsy causes stress. I decided that I should spend more time on what to do about it. So all that to say that I think when we think about stress, we think about it though in this compounding way, where like today's work life already causes a lot of chronic stress, right? Like we already know that life is expensive, very expensive, today's world, that most people are either struggling to make ends meet or having to do, creative things to make it work, or if you have children, a lot of times people need two parents working, or somebody has to make a lot of sacrifices in order to make that work. So we know life is expensive. We know resources are hard to come by. We also know that compared to most of human history, we are more isolated than ever before. Most of human history, people lived in group settings and helped each other take care of each other and their children together. And so people were not so much isolated into their own spaces without as much connection. And, if you had difficulties, with transportation, things like that, it just didn't have as much impact when you all lived together in a shared setting as it does now when we're all separated into our own spaces. So there's already a lot of chronic stress in today's world. You throw in epilepsy, we know all of the additional things that adds with, tedious medication regimens, dealing with seizures, restrictions, transportation issues, all kinds of additional things, other medical conditions. And then there's the pandemic, which has just thrown enormous exacerbation on things in the past couple of years. So I just want to do a very quick thing where I don't even need to tell you all of this, but I do want you to know that we've studied it now, and we actually know that most people in the past 2 years are reporting worsened stress than typical for themselves, sleep issues, mood issues, worry issues, reduced engagement in their own medical care just because they can't access appointments, they can't get in, they're trying to stay safe at home. We know that people like this new wave, quick new surveys since this new wave has started is just showing people are done. They are burned out. This is just sort of hitting a limit for them with just more restrictions, having to worry again. They did the thing, maybe they got the vaccination or they had COVID, or they took all the precautions and now we're doing it again. And so the burnout factor is causing a lot of issues too. And we know that it's had an impact on our lives in a variety of ways, right? And I just kind of made a list just so we could see it, not because I necessarily need to go through all of it, but it's added a lot of difficulties, right? From like trying to get toilet paper for a while to your team calls and cancels your appointment because we can't have this many people and we need the nurses to transfer to COVID units. So it's been really challenging. And also for some of us, our normal stress management techniques have maybe needed to be changed through all of this because if you can't access the groups or the exercise, the gym, or if you can't access your therapist, or if you can't access your loved ones, that has added increased burden as well. And so people's typical stress management approaches have maybe not been able to be used through these past 2 years. And maybe you've come up with new ones, maybe you haven't, or maybe you've come up with ones that were not ideal, but that you were hoping were temporary at the beginning of the pandemic and have turned into a longer problem. Like I had plenty of people who were having an extra alcoholic drink at night, or plenty of people who were sleeping different hours because they could. And that was always intended to be temporary. And yet it kind of turned into a longer term thing that now we want to try to work on. So just pointing that out briefly. So, but really what I want to focus on tonight is talking about some techniques, giving you some instruction on some of those, but also resources that you can use, hopefully without having to find a new therapist in order to use them. While also understanding that if there's something you really love, like if you go try one of these things and you really like it and you wish you knew more about it or could get some help applying it in different situations, or just learn more techniques like it, that either I give you some resources for kind of digging deeper in like some self-guided intervention approaches, or give you some information on how to find a therapist. But hopefully you can get a little bit that you can use on your own. So when before I went to graduate school, I didn't know a lot of these techniques, and being trained in them, in addition to just really enjoying my career, being trained to do my job supplied me with techniques that have definitely changed my life. I think that having access to these things, I can't tell you how often I've thought, I wish we just taught kids formally in school some of these stress management techniques very directly, because I think that it's just too bad that many of us, including myself, are learning them as adults. And so I think with the training I've had, the patients I've had, and then just my own experience, these are the things that I think kind of could be a good just starter pack for you of things you could maybe use. I will say the first one, acceptance, is maybe not one I would have spent time on tonight. I'm going to show you more about it in a second, but it's something that is in an entire area of therapy, and other therapy types have parts of it incorporated. But I will say, my husband, so we have a 4-year-old, we have a 1-year-old, and then we are actually realizing this week that we are absolutely bonkers. We got a puppy too a week ago. So we have a lot of chaos in our house. And my husband, after our second baby, decided to pursue some therapy for basically some anxiety around just being really overstimulated. Like, just a lot of noise and a lot of chaos is really stressful for him. And I think that is something that really commonly occurs in epilepsy. There's actually research on that, and it's something a lot of my patients talk about. And so when I asked him, he's been in really regular therapy for a couple of months. And when I asked him, what do you think's been the most, useful interventions that I could maybe incorporate? He just hands down said to talk about acceptance. So I will briefly talk about that. And then I will tell you more about where to get more information on that too. So acceptance for stress reduction. So the idea is that so many of us, when we feel overwhelmed, our immediate reaction is to reject it. Our immediate reaction is to say, like, I cannot handle this, or this cannot be my life, or I can't live like this forever, that kind of thing. And we do so much trying to push it away because it is hard and painful that we oftentimes are not in the mindset to actually help ourselves. So many therapists actually start with
That's what it is.
if you can just intentionally acknowledge where you are, what is going on, the entire situation, and accept it as what it is in that moment, including your reaction to it, it can be really helpful. And that includes identifying your emotions. So like I'm just imagining a couple of times when we have had like screaming, one tantruming child, one who's like breaking something, a dog who's going to the bathroom on the carpet, and there is no immediate way out of it, but through it, right? I mean, we cannot just like both run out the door and escape it all, because they cannot be left alone, right? And so the idea is that actually the best way to get through it is to just identify that, like, this is overwhelming, and this is too much, and also this is just it right now. You look at the bottom there, some people say like their mantra is, it is just what it is right now, and I can't change it right now. And an important aspect of that is that you are not accepting it forever, and you are not agreeing with it. All you are doing is accepting that this is where we are, because the idea is that rejecting it makes us suffer more. And it also puts us in a mindset of not being able to access any coping mechanisms, where we're so focused on just feeling how terrible it is, which can increase all of that physical reactivity. And so accepting where we are lets us just get through the moment without making the moment worse, respond to it, knowing that we may need to do some things to be able to make this better in the future. And this is not where we always want to be. And this is not how we want the situation to be forever. But for right now, we are just going to accept that this is my reality and I am overwhelmed. That's all it is. This is more of an attitude than like a true intervention. And you could read more about this. And actually, I attached an article linked to this, and I'm going to send all of this to Laura so she can send it out to you. But it really is just a way of thinking that can be really helpful for kind of just de-escalating yourself a little bit. And then I'll give you other things to de-escalate too. So we just cannot ignore the importance of just balancing our overall health for stress management. So I pulled from a lot of different therapies to make this. My absolute favorite therapy for just straight good handouts with coping skills that you can actually buy some things now that are like self-guided is dialectical behavioral therapy, which I wrote down for you on a later slide. But one of the skills from that is called the please skill. And the idea is that it's basically like, please take care of your body and yourself. And so it's broken down as an acronym, with the idea being that you're doing a couple of things just to help keep stress from overwhelming your body. Also to help make yourself better able to manage stress when it comes up. Because if all of your basic needs are met, things feel easier when your basic needs are not met, especially sleep, frankly. So a couple of things. So like managing your physical illness, this can mean that anything you're dealing with, from I guess I would say primarily taking medications on time. I think, especially in the context of epilepsy, I think the number one time that people come into me and say things were going well with epilepsy and then they fell apart is when they stop taking their medications or when they skip a dose and they have a seizure. And so making sure that you have a foolproof way of staying on top of let's be honest, like sometimes really tedious medication regimen can be helpful. And sometimes that means offloading it. So I have a lot of patients who it is just one more thing to try to remember, did I actually go in the bathroom and take the medicine? I mean, I know I did at some point recently, but I'm taking it once or twice a day. And so it's hard to remember, who just offload it to alarms or who use alarm-based actual pill cases. I don't know if you've seen those, but they used to be incredibly expensive, but now you can get them on Amazon for about $30 where an alarm goes off at a certain time and it doesn't stop alarming until you straight up open the pill container. And so you at least will have known you opened the pill container and that also you don't have to think about your medications. Those kinds of things sometimes just allow people to offload one of their tasks that takes up space in their brain. So whatever it takes, figuring out how to manage your physical issues is any way you can, including following up on medical appointments. If they get canceled during this COVID surge, making sure they get rescheduled, making a good list for your physicians. I mean, we all know, and the physicians know this too, that we don't have enough time in appointments as to address sometimes everything that people want to address. And so if there are things you want to address, I can't recommend any stronger to bring a list of like short, very succinct bullet point things that you want to bring up. You can hand it to the scheduler when you go to your doctor appointment. That way your physician can know coming into the room how they need to manage their time. Just make sure we're doing everything we can to manage things as well as possible. Balanced eating. I mean, that's just making sure that if you feel like you are eating too much, too little, that you are talking to somebody about that. If you need to see a nutritionist, asking for that referral, making sure you are eating. I mean, that's sometimes people are skipping meals when they are stressed. And that sometimes for me, when it comes to stress management, is even more concerning than overeating, just because of like blood sugar issues that can affect mood. Avoiding coping with mind altering substances is really, a valuable thing. I think that I actually changed the wording a little bit because initially in this skill, it's just avoid mind altering substances, but they included everything from like marijuana to alcohol to nicotine to caffeine. And I guess my big thing when I assess with people is that many types of substances aren't necessarily bad on their own in any use. I mean, sometimes people use things in a very occasional way that is probably fine. But the big piece is, are you using it to cope, and is it replacing other types of coping strategies? And is it becoming something that keeps you from doing something that would actually work more effectively? And so considering, am I coping using my, substances to cope? And if so, is that getting in my way? Sleep quality and quantity is very important. When we sleep well, everything seems easier. When we sleep poorly, everything seems harder. And then regular exercise. I would say that when it comes to the research, we know that 135 minutes a week is really is the threshold for seeing it as an actual evidence-based intervention for improving depression and anxiety, as well as stress management. You can do anything if you want that gets your heart rate up a little bit, as long as it's in 10-minute increments. You could break it down into 10-minute increments throughout the week. You could do a couple of long ones, a bunch of short ones, whatever, but the goal would be eventually to get to 135 minutes a week if you wanted it to function as like an antidepressant in a way. But otherwise, any exercise offloads some of the tension from stress. Quick sleep stuff, I'm going to send this to you, but if you have sleep issues, sleep is most of my background training. And so breaking it down to one intervention is hard, but actually when they break down some of our sleep protocols in the research, they find that if people start with this one intervention, many people's insomnia goes away if they actually follow it. So this is it. It's called stimulus control. And the idea is that you quit trying to sleep, like actually don't try, because good sleepers and animals and babies and children do not try. Sleep unfolds as a natural process when nothing is in the way to stop it. And you're using the bed only for sleep. Don't get into bed until you are sleepy and drowsy, not just when you think you should be, but when you actually feel it. You give yourself about 20 minutes based on what you think about 20 minutes has been. If you're still awake, you get out of bed, you do something relaxing. And then when you're drowsy again, you get back into bed, rinse and repeat, and then wake up at the same time every day, no matter whether you had a good night of sleep or not, and try not to compensate by napping or going to bed early the next night. And if people do that, it usually regulates itself in a week. And it's really hard to do, I will say too, because it's hard to get yourself out of bed when you really think that you should be trying harder to sleep by staying in bed longer. But this is actually incredibly effective. And if it's not, then it's probably worth seeing somebody to help with sleep a little bit. So then reducing hyperarousal is a big thing with stress, right? I mean, that's actually really what stress is. It's ends up being hyperarousal. And there's a lot of ways that that is talked about, whether it's, we will say in like the medical or the scientific context, it's increased sympathetic nervous system activation or this activated stress response system. But essentially your body is being dumped with a bunch of cortisol and adrenaline to prepare you for fight or flight. It's preparing you like, there's a bear there. Should you fight the bear or should you run from the bear? Either way, you need a lot of extra energy. You need your blood to pump to get extra blood to those arms and legs so you can do what you need to do. It shuts down a lot of things in your brain. It makes your brain think that the bear is closer than it is. So you'll take it really seriously so you don't die by mistaking how far away it is. Your brain does a lot of things to help you survive stress because it responds to stress as an emergency response situation. But the problem is that when we have kind of this low level chronic activation of stress, when you're kind of stewing in your cortisol and adrenaline, you're not burning it up by running away or fighting. A lot of people will end up having a lot of side effects from that. And some of these things below is what people will start noticing. They'll start noticing that their thoughts race, that it goes really negative because their brain is designed to say, no, the bear's only 5 feet, not 10 feet. So run faster. It's designed to overemphasize the problem. So it's going to look for the reason why you feel so stressed. And it's going to make your mind race and turn and think about lots of different options. People will notice their vision gets wonky. They'll feel kind of lightheaded and dizzy. They'll feel like they are not breathing deeply or that their breathing is faster, that their chest feels tight, sweaty palms especially. They'll notice their heart rate. They can feel it. They feel tense. They feel kind of nauseous or their stomach's upset. Their mouth is dry, lots of things. But that doesn't make us feel less stressed either when our body's in that state. We feel it. We can tell we're stewing in the cortisol and adrenaline. So techniques, kind of emergency techniques for reducing hyperarousal is a couple of things. So the biggest one, honestly, that you could incorporate right now is deep breathing, diaphragmatic breathing. And most people think that that's just because taking a deep breath is like cleansing and relaxing, and true, but actually diaphragmatic breathing, where you are taking a big enough breath that you are actually feeling the diaphragm under your rib, in your rib cage expand, where your belly is filling with air. That actually is linked to a feedback loop to the parasympathetic nervous system, telling it to shut down the sympathetic nervous system. So doing those big, deep belly breaths where you actually can feel your diaphragm stretching inside, basically you feel like your rib cage is stretching because your breath is that big, that actually will reduce the release of cortisol and adrenaline and actually help with stress management just by doing that. And then I usually have people add on progressive muscle relaxation, which is going head to toe, tensing, holding tension, and then releasing it in every major muscle group head to toe. And I really recommend doing that as a guided intervention, which I'll give you resources for that. Because if you do it, if you try to do it on your own, you're having to think too much about like, am I breathing right and doing my muscles? So having someone else tell you what to do is really helpful. There's other types too that I'll tell that the resource I will give you teaches you about, but this just brings down stress. A stretching routine, like head to toe muscle stretching, where you hold your stretches like head to toe for, it ends up taking 20, 30 minutes, or yoga type movements. Those things actually reduce stress, the stress response system as well, because we hold tension when we're hypervigilant because of a bear. But then when the muscles are starting to relax, it sends feedback to the brain. It's okay to shut down. So it's another way to kind of trick your brain into calming down. Quick bouts of exercise do the same thing. If you go up and down the stairs a couple of times and get your heart rate up and hold it up for a couple of minutes, and then your body has to recover that, it often drags down that stress response system too. Then there's grounding. The intervention I'm going to give you is going to walk through that, but essentially it's going through 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing you can taste. And the idea is that you are trying to notice it keenly enough that you could describe it to somebody who's not there. And that gets your senses involved to where your brain can't do both. It can't escalate as if something's an emergency and be like, wait a minute, why are we focusing on this? It ends up diverting resources and taking down hyperarousal. And then there's a technique that really rapidly brings down panic attacks, anger, feeling completely overwhelmed. And that's a combination of an ice pack over the eyes and upper cheeks, basically this area, and holding your breath for 30 seconds. That activates something called the mammalian diving reflex, which if somebody wants to ask about that in questions, I can talk more about it. But basically, it rapidly reduces sympathetic nervous system activation in order to preserve resources. But for us, it just calms your body down. So it's a quick and easy way to do it. Big things with improving mood. Well, and actually, oh, I missed, hold on one second. What am I just looked at this slide. Okay, well, I'm so sorry. I must have literally, when I was uploading this, I must have deleted one of my slides. So I was going to briefly tell you at the beginning that I do cognitive behavioral therapy, and that cognitive behavioral therapy really has us looking at a triangle with the idea, here's a triangle, with the idea being that it's divided into thoughts, feelings, and behaviors. And the idea is that we believe that thoughts, feelings, and behaviors really influence how we feel, how we feel about stress, how we feel about mood, and that they're interdependent and they work with each other and influence each other. So that how you are, the things you're actually thinking, the things that are going through your head influence how you feel emotions wise and what you do or don't do. And then what you do or don't do influences how you feel mood wise and what you think, and same with how you feel. So we try with cognitive behavioral therapy to target one or more of those things, knowing that it will influence the other things as well. So, we talked about taking care of your body, which is really very behavioral, with the idea being that that's going to improve your thoughts and feelings, and talked about, reducing hyperarousal, which is going to improve in some way how you feel, but also improving mood does. And kind of a quick and dirty ways to improve your mood. These words are from dialectical behavioral therapy as well, is called opposite to mood activities. If you are feeling really down, your tendency may be to listen to really down music, but actually opposite to mood interventions tell us we should be doing the opposite. We should be doing the things that generally lift our mood up a little bit and try to increase our enjoyment, to try to influence that down mood that's dragging down our thoughts and dragging down our behaviors. Some people really do well by engaging their senses with this, warm shower, stuff that smells really good in the shower, cooking and smelling and tasting the stuff that you're doing, doing things with aromatherapy, doing things with music, getting outside, enjoying nature, just trying to engage things that really get a lot of your senses activated can be really helpful for mood. And then just straight distraction. I mean, we're just trying to get through. So if it's going to a movie, if it is doing something that's just fun for you, that usually works, we activate that. But also increasing enjoyment behaviorally is incredibly important for managing stress. And we actually, kids are great at this. Adults, we are terrible at this. Like, we generally, by the time we're stressed, we're like, I don't know, I can't do anything right now. I'm too stressed out. I can't do anything. People will tell me I have epilepsy. I can't do anything that I care about doing. And so sometimes this requires therapy. Like, this is sometimes where I start in therapy, is that we need to find a way to bring back enjoyment into your life. And this is kind of what I do, is I will have people identify things they've ever enjoyed doing before. And I've had plenty of people, and I will say that, not to stereotype, but it has most commonly for me been men who retire, who never developed enjoyable activities because they worked so much, who I've seen struggle, who they say, I've never enjoyed anything. I just worked and now I've retired. And so now I don't have anything that I enjoy. So then it takes some effort to be like, well, what did you enjoy about work? What were the pieces of it you liked? So it's helping people figure out how to re-engage with things that they've just stopped doing because of stress and depression and anxiety. Sometimes we have to modify those things, either because of the pandemic or because of epilepsy. So sometimes you can figure that out on your own. Sometimes going to therapy is actually really helpful for that, or coming up with new things, because adults tend to narrow their interests and their activities until it's very limited what they still do. And we sometimes need to kind of step back and figure out, well, what haven't you tried that might actually be fun? Trying to have a social component involved, trying to make sure that you've identified any barriers to it, trying to problem solve those issues as much as you can. Some of those issues might require therapy with somebody, or doing some of these interventions to be able to get there. But we need a plan. We need to find some things you enjoy. So I've had people do different crafts. I've had people just plan a monthly time with their friends. To go back to my husband, since I've already dragged him into this, One of the things that he ended up doing when his therapist said, well, what are you doing for fun? And he just told me, he stared back and said, I have a 1-year-old and a 4-year-old and I work full time. Like, it's a pandemic. I'm not doing anything for fun. Well, okay, so then that's why we're in therapy, right? And also your wife can't do that for you, even though she's a therapist. That's not a good partnership. So he did that in therapy, and he's now doing a pottery class where he wears a mask, and he's really enjoyed that. That's been something really different for him. So the point is, sometimes we have to get creative, and sometimes we have to pace ourselves. Sometimes we have to figure out how to ease back into the activity so we don't flare up, fatigue or sleep issues, or if you have really low motivation, sometimes we have to really kind of gradually build and work into enjoyable activities. And again, sometimes therapy is helpful for that. Managing worry is hard. That is, I think, the hardest thing. I personally believe in the therapy that I do, that helping people with worry-based anxiety is the hardest thing. Not because it's impossible to treat at all, just because it involves the work of figuring out what kinds of actual worries are you having? Is it like a moving target? Is it one thing? And then figuring out, well, what's kind of the underlying thing that's, really the big fear? Is it about social anxiety? Is it about, not trusting your body anymore? Especially people with epilepsy often have that worry. So it's kind of figuring out what's going on with the thoughts and then figuring out how to most effectively change them. So what we typically do with worry is either we're challenging the worry, we're telling the brain, just like with telling me the bear was 5 feet away and then turns out it wasn't a bear, it was like a huge rock that looked like a bear, so you overreacted. It's telling the brain that, okay, going to the grocery store and buying something was not the terrible thing that you told me it was going to be when I thought about leaving the house. Sometimes it's challenging the intensity of the thoughts your brain is feeding you. Sometimes it's just managing how much a real life worry impacts your brain day to day, just how much of the time and space it gets. Sometimes it's problem solving the actual worry itself and making it go away because you've solved the problem. The easiest one for me to teach you that works for some people and not for other people is called postponing worry, or worry time, if you've been in therapy. And this is the idea that not all worries are wrong, right? Like, sometimes our worries are very valid. They're true. It's just that how much of the day that the brain spends devoted to them gets in our way of doing other things and enjoying ourselves. And so the idea of postponing worry is that we're compartmentalizing it to some extent. We are giving it 45 minutes a day where you can obsessively worry all you want. You can let your brain go wild, but the rest of the day, you're basically just jotting it down on a piece of paper. You're telling your brain, I will come back to this at 6:30 every night. But for now, I'm going to come back to the present moment in what I'm doing. That can be really helpful. It also helps to have a little more formalized than how I just said it. So one of the handouts I'm going to give you has a section on that, but also I'm going to give you a longer handout that was developed at the beginning of the pandemic for managing worry, that is fully self-guided, that will walk you through how to problem solve out your worries, which things can we actually solve by just spending more time on it, and which things are not worth spending more time on it because it's just draining your energy because you can't solve it. And then how do we manage those worries? And it's really helpful. So I'll give you that. So since I can't really do that in a very broad and general way on here, I'll give you the self-guided one to work through. And okay, so if you liked some of these skills and you want to do more with them, most of them are from cognitive behavioral therapy. Some of them are from dialectical behavioral therapy, which is honestly, it's part of cognitive behavioral therapy. Mindfulness-based stress reduction does a lot of the like relaxation type stuff. It also does a lot of work on just trying to recognize that you are having like a lot of pain or anxiety or depression, and just trying to be very grounded in the present moment. So some of this was more mindfulness stuff. And then acceptance and commitment therapy is a whole area of therapy that just really focuses on that acceptance piece. And so some people, I don't do that. I do all cognitive behavioral therapy and then some of the dialectical behavioral and mindfulness stuff. But some of my patients, if they've tried these more active approaches with me of changing things and they don't like that, they've loved acceptance. And so then we find them an acceptance and commitment therapist. My two favorite self-guided resources are the handout I was mentioning. I'm going to send you that. It is very good. Actually, I was going to show it to you really quick. So it is this. It's this packet that, again, they put it out at the beginning of the pandemic, but it works for anything with uncertainty. It works really well with epilepsy, especially when your seizures are really unpredictable. It's basically about living with worry and uncertainty when you don't know exactly what to predict. So it works for a lot of different things, but it was made with the pandemic in mind. So literally it walks you through understanding worry and anxiety, figuring out how to problem solve, it talks about some of that please stuff that I mentioned earlier, but how to problem solve, whether it's something we can actively solve or whether we need to manage the worry itself. And then I just wanted to show you, let's see, there's a whole thing on how to postpone worry. There's a whole thing on how to challenge your worries and kind of change them to be a little bit more balanced. And then some other ideas for just how to better analyze and understand your worry. So I'm going to send you that, which I think is really great. And then the other thing I'm going to send you that I like even better is a more, if you use apps as a more active approach, is an amazing, amazing app. Show you this. Laura, can we do one minute on something? Is that okay? Or are we really pressed for time?
No. I'm fine.
Okay.
This is very valuable. So yes.
Okay. So I'm sorry. I really struggle with short.
No, you're totally fine. I'm fully engrossed. So please, I think this is so helpful.
Okay. So are you seeing a video screen? Okay. This is 1 minute. It's longer than that. I'll give you the link for this too, but it's a 1 minute description of the app that's better than me because it shows it to you. So hopefully you can.
The COVID-19 pandemic is causing anxiety and worry about our health and safety, our loved ones, our financial stability, and uncertainty about the future. The COVID Coach app can help you get through this time of uncertainty by teaching you how to practice self-care, find ways to stay socially connected while being physically distant, find meaning during this stressful time, and cope with the many challenges you may now be facing. Let's explore the 4 main sections of the app. In the Manage Stress section, you can find coping tools to use when you're feeling upset, anxious, or stressed. These tools are all designed to be used from the safety of your home. Use Connect with others to feel less isolated, mindfulness to slow down, or indoor activities to find fun activities you can safely do in your home. Tap the thumbs up for tools that worked well for you, so you can find them again quickly in the Favorites tab or on the home screen. The Learn section.
Okay, I'm going to stop there just for time, but I'll give you that link too. But I just wanted you to be able to see it and see this managed stress component of it. Go back to the slides. I love this app. I have a friend who works on the VA app development team, and she told me that they made this when they thought that therapy was just going to be shut down in the pandemic. They were worried because there was no telehealth at the beginning, going way back. People could not be in a room with somebody less than 6 feet apart for an hour. And so they just did not know what was going to happen. So they developed this app that, that is fully self-guided and incredibly just skill-based. And it is intended to be taught to you the same way that I would teach it to you in a therapy session. And it's well done, and it's free, which is really nice. It has, you may have noticed as they were skimming through it, a lot of the stuff I said on here was on there. What they didn't show you is that they have self-guided versions of the diaphragmatic breathing and the progressive muscle relaxation with the diaphragmatic breathing, as well as other types of relaxation skills. They have a whole section on sleep. They have a whole section on other types of just physical self-care. And then if you start liking things, like thumbs upping things on there, it'll just start taking you to more things that are like it. So it's sort of adaptive for you as well. All that to say that I can't do that much in 30 minutes, especially for individual things, but this really might be something that's helpful for a lot of people. So other than that, I just wanted to give you, and you'll have this because I'm going to send you my slides on how to find a mental health professional if you need one. It's really hard to do right now, which is why I gave you a lot of self-guided interventions. We're really bottlenecked in my field right now. Many people are booked out 3 months. And so if you need a therapist and you have an EAP at work, or if your insurance company has any sort of, sometimes some of them have like little programs that are self-guided or that attach you to people directly. If they have anything, I would take advantage of that. If there's anything through anywhere that you are engaged that has any type of assistance, I would go for that, just because wait lists are so long. But otherwise, here's how to find somebody who's evidence-based, and also might have some expertise in health psychology, so might understand epilepsy a little bit. And then I would say my big things is I would use psychologytoday.com, because they're just it's so well laid out to where you can specify cognitive behavioral therapy or acceptance and commitment therapy or whatever you want. And then the 2 things I recommend is read their bios. They wrote them themselves. So if it sounds like really wonky, that means they probably are, frankly, because there are bad people in every profession and there are a lot of variations in therapists. And then the biggest thing I can say is look at the list of therapies that they say that they do, which is a structured part of that website, on each person's bio. And if they've checked too many types of therapies that they don't do any of them well, is like a big rule of thumb, because none of us are, if we're good, we're not trained in very many. And so no one should be saying they do 25 types of therapy. So just a little tip. And then other than that, resources, I will give you a longer explanation of the acceptance thing. And then you can also look into acceptance and commitment therapy if you're intrigued by it. There's more on that page on the COVID Coach app than I showed you. So I'll give you that link as well, but you also can just go get COVID Coach. It's a terrible name. I don't think it aged well 2 years later, but it's pretty though, actually. And then I'll send that packet. And then otherwise I put my email address on here. So if there are things that you liked the idea of, but you just wish you had like handouts to use, feel free to email me. I have a lot of handouts, so I'm happy to send them. And then otherwise I just wanted to highlight KU's Epilepsy Patient and Family Education Series. It's available to anyone. It's not a support. Somebody asked about support groups, and I don't know of any, especially right now. So many support groups were shut down at the beginning of the pandemic and just have not restarted in different areas that I work. I don't know of any for epilepsy right now specifically, but I did want to mention this just because it is an education series that involves a lot of webinars like this all throughout the year. So these are our dates for 2022. I would just talk to our coordinator. We don't have content for those yet, but it'll get updated. And you can always reach out to me about that when we have, and I can send the flyer back. So I know people had questions. I tried to write some of my slides with the idea of the questions in theory, but I also have more information about questions if people want to talk about anything else. So.
Great. Thank you so much, Kelsey. This was incredible. There's just so many things that stuck out to me. And I really love the idea of postponing worry. I think that, for me, I know I tend to dwell on that. And so writing it down and having like sacred time to like come back to it, and or that old adage of like, if you're really angry, you write a letter and then you never send it. So like just writing down the worry, addressing it, and then throwing it away, like was really powerful. I did want to touch on, so our foundation, so I'm the CEO for the local Epilepsy Foundation, and I have 2 of my fantastic colleagues on this call as well. While we don't have official formal, there's Michelle, she just waved. She is our program manager here in St. Louis, and then Bridget is also on the line. She's our program director in Kansas City. So while we don't have official support groups, we have been really thoughtful and intentional about ways we can offer opportunities for some connection. And so in St. Louis and Kansas City, both, we periodically offer art events, for caregivers. We also have caregiver events, movie nights. You'll see more of those as we're able to get back in person, but certainly we're always here as a resource too. So I also have already downloaded COVID Coach. So I think this is fantastic. If anybody else, I saw Amanda said she was checking it out too. I think that's amazing. So happy to open it up for questions for anyone that's on the line. Kelsey, I was just looking back, and a couple of the questions was around letting your employer know that you're trying to manage stress. So do you have any guidance on that, or how? I will say, I think that there's been a shift in the pandemic about the conversation around mental health. I think has become more open. we're certainly not where we need to be, but I just wonder like what you would suggest for someone who maybe during the day would have to do some of these things like, and a lot of it, I guess people wouldn't otherwise notice, especially if you're working remotely, like deep breathing or grounding. But just wanted your thoughts on that.
Yeah, so I was trying to introduce some skills tonight that would be able to be done by like stepping into the bathroom for a couple of minutes or something, that would be brief. But I also feel like I saw, the questions too. And I think some of it was truly like, if I need to tell my employer that things are harder for me, like, how do I do that? And I think that those questions come from the fear of stigma around epilepsy, which is very real, even though we know that accommodations should happen like legally. We also know that there's a lot of gray area and what actually ends up happening in reality. So I know people are scared. And I would say that the best thing you could do, other than have techniques you can use on, kind of slyly, at work, but I would really try to figure out really specifically what your goal is from your employer. And I would write it down. I would write out what you want to walk away from or walk away with from it, and then ask for that really specifically. If the people who ask those questions want help with a script, I have a really great handout on how to script out asking for something that you're not sure how the other person is going to respond to, and helping you be able to draft out like what you're actually asking for. It helps you like figure out how to have your body, how to have your face, how to have your thoughts, how to check in with yourself as you're going along to make sure that you're able to check your emotions and keep them manageable so that you can think clearly, but also, negotiate and follow up and just really try to essentially get what you want without making the relationship worse is the takeaway. So if anybody wants a handout on that, feel free to reach out to me. But I think the big thing is just recognizing that sometimes you can fit in some interventions in the day that work great. I have had plenty of patients I've worked with who we've been able to do that. Other times it is that you actually need the formal 15-minute break that you were supposed to get to do these things. And we have to make it, figure out how to make it work. Sometimes it's that people that like their employers would let them take their breaks, but people just aren't good at doing it. And so sometimes it's just figuring out how to actually manage the workday so you can take the time that you're guaranteed to do some stress management. But I agree, being able to, for some people who can still work from home, that's also been really helpful for flexibility more than ever before.
Yeah, I speak for myself and my staff. We'd love that script because I think that's really helpful to be able to like have those conversations in a productive way. And I know you touched on this a little bit, especially in dealing with your spouse, but I thought this question was so interesting. So as a spouse of someone with epilepsy, I'm interested in hearing about supporting my partner in stress management without falling into codependent patterns. I thought that was so interesting. I think like as caretakers and wives and mothers, like how do you navigate your own stressors? I mean, that was something that was really caused me to worry during the pandemic, was managing my stress for my staff, as well as my children and my husband. And so like, how do you help support others in your family life with their own stress management without making it like a codependent situation?
Right. And I know somebody else just asked about their child too, who had seizures too are triggered by stress and mood symptoms too. And so I think all of that kind of fits together of how do we support each other? And I think one thing is that a lot of these interventions are really done very effectively as a family. Some of the stuff that, I talked about my husband, but it's not like I don't need to use some of these skills now. I am also stressed in this pandemic with having kids and working and being a working mom. And so I think using these skills is really valuable. We all need stress management skills, but also like we may need to use them differently with kids. Like we may just need to do them together. That may be something more often that needs to be done when we're talking about children, is figuring out what triggers you and which of these are doable. There's lots of, if people want book recommendations for kids, by the way, I just got a bunch of books from the American Psychological Association on managing different issues in kids. And a subset of those were like mindfulness and like how to navigate big emotions and things like that. And I'm happy to, you email me, supply some of those recommendations. But it's using these interventions, I think, as a group, as a family. I think too, that when it comes to talking about partners and loved ones and even actually like employees, we can't solve problems for people. I think is a really hard reality. It's actually really hard as a clinical psychologist not to be able to solve the problems for your kids and spouse and, family members when you just think, just do this intervention, I feel like you feel better, but that doesn't work. It doesn't. asking them what kind of help they want is really beneficial. The most common complaint I get from the person about their very loving spouse is that they help me too much, or they help me sometimes when I don't need help, or they think they know what works for me, but it doesn't work for me. So like, ask what they want, but then also, once you all have determined what effective coping strategies, what the best ones, the most helpful thing you can probably do is ask if your partner wants you to help remind them to use them. Because I think when we're really anxious and overwhelmed, it's hard to remember to use the things that help, because our brain's not in that space. Our brain's in the fight or flight space, right? Naturally, biologically. And so being gently reminded, didn't you think this one thing was really helpful and want to try it when it was really, when you're in a really tough situation? That's often the most helpful thing. I heard the word codependent. I will tell you that the thing I thought, though, is not so much that most people are not really that. It's that most people, they use what works for their anxiety. And if what works for your anxiety is comfort and reassurance from a partner all the time, then that's what you'll go for, because it works. And that's helpful sometimes, but if a person ends up then being reliant on that in all stressful situations, it's limiting for trying new things, or for trying some of these other interventions, like increasing enjoyment by going and doing something on your own. If you need your partner there always, your anxiety might get worse over time, or your stress might get worse over time. And so in a lot of cases, it's me watching out for, has the strategy you're using, whether that be, smoking cigarettes or drinking alcohol, or relying on reassurance and help and someone going with you every time you go to the store, or going to sleep, or whatever it is, watching TV and spacing out, is the thing you're doing when you're feeling the worst actually keeping you from engaging in active coping strategies? And is it one you've become rely on that doesn't actually let you get out of it and move forward on your own? Then maybe we want to try to find some new ones. And so that's why I kind of really focused on, let's find coping skills that your partner can just remind you to use, as opposed to being the solution for anxiety. And same with kids, we have to teach kids, when you're at school and I'm not there, what strategies work? What can you use on your own? How can you remember them? Because I'm not always there to remind you. And so same exact thing there.
That's great. Sorry, I clicked the wrong thing. The other question I wanted to touch on a little bit was the question about overcoming low self-esteem. I think that's important, and I know that certainly can be exacerbated by epilepsy and the stigmas around it. So just wanted to touch briefly on that too for a minute, and then we will get to any questions that you guys have that have come up during this presentation. These were just some of the pre-submitted questions.
So I think that self-esteem is complicated, yeah, because a lot of people with epilepsy will tell me that just because of how it has impacted their life, it's impacted the trust they have over their body, the trust they have over their brain, trusting their memory, trusting their thought process, and a lot of people feel like they don't have a lot of good solutions for improving their own self-esteem, especially when they have a lot of limitations or restrictions from epilepsy or the pandemic. And I think that a small thing that can eventually have big benefit would be to start trying to set some really tiny goals and then meet them. That idea of pacing for enjoyable activity that I talked about earlier, where you kind of ease into it, starting to set tiny goals and meeting them, and then just building on the goals really slowly, is a lot of opportunity for your brain to see that you planned to do something and you did it and you felt better afterwards, which is really, really good for self-esteem. I had one guy who was on the couch like most days, all day, basically watching TV. And he used to exercise all the time and knew he loved that. And that was good for his coping, and he missed it. And he missed being outside, but he just could not motivate to get off the couch. And he just felt bad about himself. He's like, well, used to run 5 miles in the morning. And now I'm too tired to walk around the block. So I have no self-esteem about doing it. And so we just took off the idea that we were trying to exercise 5 miles a day. And we just, we started talking about just getting outside for a few minutes. And for him, we had to start with like getting dressed today. And then you don't even have to go, but you got dressed. And then it was like, put on your walking shoes. And then it was walk and get the mail every day. And then it was a 2-minute walk, and then a 3-minute walk, and then a 4-minute walk, and building up, because he felt so good when he set a goal and reached it. but if he'd set it too high, he never would have, and that would have been worse for self-esteem. And so these little tiny building blocks can over time actually be their own intervention for self-esteem. And then also therapy. I really think that if self-esteem issues are like really long-term and really challenging, that it probably just helps to have somebody walk through it with you and help you just come up with ways to improve it.
Absolutely. Thank you. Does anybody on the call this evening have any questions? You can feel free to unmute yourself or drop them in the chat if you'd like. While we I'm trying to see if anybody unmuted. So I wanted to ask you about this, Kelsey. So I used to have pretty bad panic attacks, and something that somebody told me, and I don't know if there is any like medicinal value in this or medical like theory to back this up, but I had this friend tell me this technique, and I use it and it works for me. I have significantly less panic attacks, but it was basically like making myself kind of into a human pretzel. So I stretch my arms like this, wrap myself like this, cross my legs, and it grounds me for like, I don't know, it's so bizarre. Like I feel like I'm just wrapped in like a personal hug, and it calms me down. I don't know what the reasoning is for it. I guess it's the same kind of purpose as my weighted blanket, because my weighted blanket does the same thing. You know, it makes me feel like I'm wrapped in a hug, and like in those moments where I feel like my breathing start to, you know, and my husband can tell when I'm starting because my hands fidget. He's like, you need to, you know, and I will immediately go into my human pretzel, and it just calms me down. So I don't, for what it's worth, if anybody ever has that, it's highly efficient for me. But I see Judy's trying it. Yes, there you go, Judy. Okay, you got it. You got your hands like this, and then pull them up to you. And then if you're standing or sitting, you can cross your leg too. It's just instantly soothing to me. Like I feel calmer just doing this. I don't know, it soothes me. So in any case, does anybody else have any questions? Nancy, I see you came off unmute. We've got a couple.
Did. So I just wanted to say Dr. Sewell is such a great resource for us tonight. I'm so happy that she was able to join us. And I wanted to echo all of the things that she has said. And just remember that if you're really struggling, please reach out to your medical professionals as well, because sometimes therapy is great. Sometimes we need to use medication along with therapy, and your medical doctor would be the person to ask about that. And then my personal stress reduction tip that I just discovered this week is if you go to the Monterey Bay Aquarium website, they have live cameras in their aquariums. So you can just watch them for hours. They have one in the jellyfish aquarium, which for whatever reason, I find it very soothing to watch jellyfish swim. And then they have one in their shark aquarium. So that's my personal thing that I discovered this week, that it just kind of is my moment of when I need it. So.
That's amazing. Water is my happy place. I think too, when we think about like kids, like I introduced the concept of a relaxing bubble bath to my teenage son, and he was very resistant to it. And then like I drew the bath for him, put in some fancy bath salts, let him be, and he's like, that was pretty cool. I was like, see, like if you ever just need a relaxing bath. So I love all these resources.
I had a patient tell me about the tanks, and then later that week I saw some article, it may have been New York Times, I'm not even sure, where they had a bunch of psychologists being like, go watch this is relaxing. And so apparently it's a more well-known thing now.
Yeah,
it really is. And maybe that's where I got it from. I don't know, but it really is. It's like
the jellyfish superior to the shark tank. The jellyfish are a little more enjoyable.
I think so. Yeah. I think so.
Yeah.
And they put relaxing music with it too, honestly. So it's just, yeah, it's kind of like a lava lamp. The jellyfish kind of like a lava lamp.
Yes.
That's awesome.
I will echo Dr. Hammond. I meant to say this when talking about the person who asked about their son's epilepsy being triggered by anxiety. One important thing is if you're trying techniques and things are not getting better, then it's possible that you might be diagnosed with a depression or an anxiety disorder. And one thing to be like, I really want to make sure that I get across is that the research is very clear that both cognitive behavioral therapy and the antidepressants are very effective for depression and anxiety, even in the context of epilepsy. And a lot of people worry that they're going to have more seizures if they take another medication. And I will tell you that especially one family, or most of the families of medications that we use for depression and anxiety, SSRIs and SNRIs, the research tells us that if anything, you are more likely to have a reduction in your seizures than an increase in your seizures, which is probably because we are treating some of the triggers for some people.
Yeah.
So reaching out for that help if you feel like you've tried techniques and it hasn't gotten better. And especially right now, if you're having a hard time getting into a therapist, an antidepressant can be a good way to start.
Does anybody else have any questions while we've got Dr. Sewell and Dr. Hammond on the line? It's very quiet tonight. That's good. I hope everybody learned a lot. I saw some folks were downloading the app, and happy to send out those handouts. Kelsey, if you want to send them to me, I'll make sure everyone gets them. We did record this, and so it takes a little while for it to download and for me to kind of splice it a little bit so you don't hear the beginning when I'm having my tech issues, but we'll get that out to you guys probably next week, and then it'll also be on our website for future reference as well. And just wanted to thank Dr. Sewell again. This was so helpful. I think it's something we all struggle with, and I've always wanted to try grounding. I'm excited to like explore that a little bit more. There's just a lot of good things I think we can try. So I hope this was helpful for everyone. Stay tuned. We will be having another couple of these webinars, TBD dates and topics, but we'll be sure to send these to you, the invitations to you as we get them scheduled. And just grateful again for Dr. Sewell for being here and for Dr. Hammond for helping us organize this. I see a couple of thank yous in the chat. So
Thank you, everybody.
All right, well,
Thank
I'll
you
send
all.
you that email right now, Laura.
okay,
with all those things
perfect.
I promised.
And I will get that out to everyone. Thank you
My
so
email's
much.
in the slides for everybody. Yes.
Awesome.
All right.
Perfect.
Okay.
All right. Thank you all so much. Have a good night. Stay warm, and don't hesitate to reach out to any one of us if you have questions.